Ladies and gentlemen, welcome to Congressman Issa's Healthcare Town Hall meeting.
This is for all of you, your night to ask questions and to hear answers, and for all of those who couldn't get inside to hear it outside.
There are, I think, at last count, over 3,000 people in attendance this evening. Absolutely.
The one conclusion that I've reached over the almost 5 weeks I'll be at home is that we shouldn't throw this away, but we should recycle it. I believe that the answer is probably in mending the existing system, driving down the cost of health care. But it's also the reason that I believe that we have to preserve but make work better Medicare. Today, I think America's ready to say, we're so interested in how 18% of every nickel and dime earned in America goes into health care and why it's been rising so fast that now we do want answers that keep our high quality, drive down the cost so more people can afford it, so that we really do fix the problem of the uninsured.
It's my understanding that it's something like 42 million Americans don't have health insurance at all. So without a public option, how can you be sure that everyone will be insured, basically?
The most important point is if we can make it affordable through some plan like 3438, where people know that for $5,500 a year, or about less than $500 a month, they could in fact make sure they never were without insurance, and they know that it's an insurance that can't be canceled on them, then I think we could eliminate a lot of those. As Americans, we need to make sure, though, that if you cannot afford health care, that America will never fail to take care of you. People will not die for lack of health care in America. We simply need to make sure they go to the best health care in the most appropriate way, and not the emergency room, which is quite frankly one of the problems we have. It's about one page of substance, which simply says, whether you're a private individual or a small company, at your expense or your employer's expense, at the same rates and the same pooling system as the federal workforce enjoys, you should be able to join that, so that no one ever fear that there wouldn't be a reasonable price, large pool to be available to you. That takes care of one of the great fears, and ultimately it's not going to cost the government money, because if in fact literally millions of people, both employed and unemployed and between jobs and small employers, choose to go to that option, which is 300 choices, all that's going to happen is those organizations will have larger groups to take care of. It won't change the material cost in any negative way. It probably will even be positive. That is an area where government, by issuing an edict to insurance companies, and by the way, insurance companies are licensed by the state, so the state would issue the edict, but I would support it. All the state has to do is say, we're going to have assigned risk. We can do that, and if you want to see a model for it, government tells the phone company historically, and the electric company still, that whether you live in Shadow Ridge and you're right near a major distribution system, or you're out in the country in rural Vista, that you pay the same electric rate. And by the way, you pay the same phone rate. We made a decision years ago that America was best served by having predictable rates regardless of where you live, so that you didn't have this shifting and this unfair somebody out in the country paying so much more, because the truth is, us city folks wanted to be able to talk to our country folks, and we were willing to do it. Insurance has to be done the same way. It's one of the things that Sacramento should get off its duff and do right away for the people of California. It is extremely important.
Your criticism is that Medicare didn't work.
With only 3% total overhead in the Medicare system, they don't begin to catch even the tip of the iceberg of the fraud. It is one of the amazing problems is people are bragging about Medicare. We produced, and it's available online at issa.house.gov, and it's also available at the committee site, the Republican side oversight committee in the House. We did 32 pages on the waste and fraud and the problems that were documented in Medicare. Not because Medicare isn't a great program for seniors to rely on, but because it costs too much, pays too little for legitimate procedures, and has no good oversight. And we just wanted to make people understand this is not the model for a single payer that anybody would want.
My name is Chris Keys, and I'm from Oceanside. I actually do not accept the premise that the government should cover health care according to the Constitution. I actually have tried to read the House bill, and it is really very disconcerting.
I think your point is valid. I do not intend to vote for the elimination of people's free choice and privacy. I also don't want to ever be one who votes to nationalize something if it's at all possible for federalism to have it done at the state. And that's what really is wrong with 3200.
My question for you, though, is would you ever vote yes on a bill that does not include tort reform?
Boy, that's a great question. I believe tort reform is the most important thing, finding ways to drive down the cost. We've got to settle the question of whether or not lawyers get the money or doctors and patients get the benefits. Why is it we need 1,100 pages and everything being done? Why is it we're not dealing with the rising cost of health care through tort reform? Why is it we're not dealing with the cost of bringing medicines to market through FDA and streamlining that? And why aren't we dealing with pre-existing conditions, something that either the states or the federal government or a combination could do like this? You're exactly right that that's what we should do. And I will tell you, that's a message I'm taking back, is that that's what people want in my district.